So for the next up, we'll look at what is known as what? The uterine artery embolization. So of course, when you look at, if you look at, they are talking about any artery, and they are talking about embolization, you just have to do it. You are blocking blood flow in that artery. Yes. So let's look at several reasons why you might actually want to do this. One of the reasons could be that the woman is bleeding too much. So you have to just block the artery to stop the bleeding. So you can see how they do it. Alright. They pass a catheter, alright, down to actually what? Embolize the artery. So it's just a minimal invasive procedure. Yes, it's a surgery, but not a high surgery. This one is just a simple surgery. So you are using it to treat conditions like uterine fibroids. The woman is having heavy menstrual bleeding, and maybe she gave birth, and as she gave birth, there's some injuries to some blood vessels, so she's now bleeding too much in the process. So how you are doing this is you are trying to block blood flow in the uterine artery. You are trying to block the blood flow in that artery. Okay, so a catheter is inserted through a small incision in the groin and is guided. All right, look at this. So here the incision was here, so they followed through the femoral artery down to locate the uterine artery. Do you understand? So it's guided, right? You might be using some images to help you move accordingly. So the catheter is guided to the uterine arteries. Now tiny particles, that's like the tiny particles are like sands of grains. They are polyvinyl particles. You put them in the blood vessel, so they kind of like coagulate, then they stop blood flow. So tiny particles are injected. They block the blood flow to fibroids, or if it was bleeding, it will block the blood flow to the bleeding. Do you understand? So fibroids are all those uterine growths and all of that. Of course, the fibroids grow. This is because they have a lot of blood supply. So once you stop the blood supply to them, you are basically stopping their growth. You understand? So this will now cause the fibroids to like starve, literally. So they starve, okay, and if there's bleeding, it will now make the bleeding to stop. So common uses, okay, that's like you using this to actually treat a lot of conditions. Uterine fibroids, and also the woman is bleeding too much after childbirth. You want to stop that. Then also if there's tumors, you want to actually stop blood supply to the tumors and all. So benefits is it preserve the uterus, okay? The shorter recovery time than the open surgery, can treat multiple fibroids simultaneously. Risks and consideration is could lead to pain, infection, bruising, premature menopause, infertility, or pregnancy complications. Alright, so that was what the uterine artery embolization simply is.